Now, from the Career Tech Studios in Stillwater, here's your host, Rob McClendon.
At 2,500 pages, the Patient Protection and Affordable Care Act is as complicated as it is thick. Approved by Congress and signed by the President in February, we're now starting to see some of the first changes taking place. Today, we'll do our very best to explain what this piece of legislation is and what it isn't. Our guest this week is Oklahoma Insurance Commissioner Kim Holland. But before we get to her, here's some background.
We don't have anything to do. We don't. You have to wait out.
From packed church auditoriums to smaller civic clubs, democracy spoke up last summer.
Every community that I did an August town meeting 1 year ago and repeated with an August town meeting this year, the turnout was 10 times larger. Not 10%, 10 times larger.
Congressman Frank Lucas represents Oklahoma's sprawling 3rd Congressional District.
It's an amazing outflow of pouring of people. And they're not just political activists of one side or the other. In my small communities, I know all those people, both sides of the political spectrum. These people are overwhelmingly real folks, first-time attendees. They've never been to a town meeting before. That says something about what's rumbling across the countryside.
Primarily with concern over the future of U.S. health care and who pays for it. Gladene Allred is president of Stillwater's League of Women Voters.
Public option is a government-administered program similar to Medicare, and Medicare has been around since the 60s, and we haven't become socialized medicine. We still have private insurance, and so this is an option. And as long as there are people who are sick and suffering and can't have care, it affects all of us.
But not everyone agreed. Oklahoma Senator Tom Coburn has earned a reputation for his work to trim federal spending and campaigned against the cost health care reform could bring.
The first answer comes out of Washington: it ought to cost less, not more. And the second is we ought to make sure we empower what is working well to stay and address that which is not working well, which is prevention, wellness, and management of chronic disease. You start controlling those, that's 75% of the cost of health care. And so we can fix it, but you don't have to tear up the whole system to fix it, and you don't have to remove people from what they like in the name of fixing it. And so that's the real risk.
But despite such heated opposition through the summer and fall, in February, a final health care reform bill passed on partisan lines and was signed into law by the president. Yet the debate is far from over.
Many in Washington want to bring change to health care, but what kind of change? The same change as in Massachusetts, where they say whether you want it or not, you will buy health insurance. It's mandatory. But does this work for everyone?
Such ads have become commonplace this political season, with many candidates campaigning against any health care reform and pledging to opt out from the federal guidelines if elected. But whether that is even possible is also up for debate. This summer, voters from neighboring Missouri voted to opt out of the new health care law, a move that joins a similar suit brought by attorney generals in 20 other states, all of which will be ultimately heading to federal court.